Polio is a highly contagious disease that can cause paralysis and even death. The only way to protect children from polio is to ensure that they are vaccinated against it. Pakistan is one of the few countries that have not yet eradicated polio.
As you're aware that vaccines are one of the most significant medical advances ever. Thanks to immunization, smallpox is eliminated. Thanks to immunization, once feared illnesses like diphtheria, tetanus, measles, and meningitis are now simply preventable. Thanks to immunization, polio has been largely eliminated. Unfortunately, Pakistan has yet not been declared as polio-free state.
There are still pockets of resistance where parents are reluctant to vaccinate their children, mainly due to misinformation about the vaccine. Chaman and Kila Abdullah are bordering districts of Balochistan with Afghanistan. One of the challenges in these areas is the difficult terrain, and security concerns make it difficult for health workers to reach children in need of vaccination.
District Chaman and Kila Abdullah have very low routine immunization, and there are very limited health facilities. We have a very limited government structure there. These are the high risk districts of Balochistan where the polio cases have been reported in previous years.
To help the government of Balochistan eradicate polio from the area, the International Federation of Red Cross and Pakistan Red Crescent Societies started a project with the financial support of CDC in Kila Abdullah and Chaman districts.
Started in 2019, CDC funded project of routine immunization supported by IFRC is one of the programs in Pakistan which is eradicating polio with the help of its unique methods. Polio and routine immunization is not something that is unique. It is happening everywhere across the board all over the world. But what makes us different and unique is the way we do, what we do, and where we do.
It is our CDC funded program on routine immunization. It is the most difficult area in the country. We have the huge team in working Kila Abdullah and Chaman, very talented team working in the vaccination and the mobilization.
A mobilization drive was launched to convince parents of the importance of vaccination. Under the campaign, mobilization sessions were conducted in the communities where people were informed about the dangers of polio and the importance of vaccination. Under the project, vaccination clinics were also established to support the regular immunization efforts in the community.
मैं आपकी ये जो ARC सेंटर है ये विज़िट किया, मुझे बड़ी खुशी हुई कि आपका स्टाफ सारा मौजूद था और बड़ा रश भी है। ख़वातीन बच्चे यहाँ आपके स्टैटिक सेंटर ला के इम्यूनाइजेशन कर रहे हैं। मेरी नज़र में सबसे ज़्यादा इम्पोर्टेंस है भी रूटीन इम्यूनाइजेशन। अगर रूटीन इम्यूनाइजेशन पे हम फोकस करें, रेगुलर बजट उनका बड़ा है, तो फिर हमें ये स्पेशल कैंपेन्स करने की ज़रूरत नहीं है।
د BRCS ویکسینېشن راغلي دي خپل کوچنیان د یوې ورځې څخه بیا تر 2 کالو پورې راولي د 12 نه جوړیانو حفاظتي ټیکې ورلګوو.
Announcements through mosques have been made to mobilize the community. So far, this approach has been working as more and more parents are getting their children vaccinated. The mobilization of parents to get their children vaccinated against polio is an important step in the fight to eradicate the disease. To do so, village health communities have been formed in targeted areas. These communities provide information about the importance of vaccination and help to ensure that all children in the community are vaccinated. They help identify children who have not yet been vaccinated and ensure that they receive necessary vaccinations. Under the project, social mobilizers go into the communities and talk to parents one-on-one. They explain how the vaccine works and dispel myths about its safety. They also provide reassurance that children will not be made sick by the vaccine. By addressing each parent's concerns, they are able to convince more people to get their children vaccinated against polio. To improve the level of awareness and to increase the expertise, a training workshop was conducted for vaccinators and social mobilizers. At this workshop, participants learned about the importance of vaccination and how to reach out to parents in their communities. They also learned how to identify children who have not yet been vaccinated and how to connect them with services.
आज हमारी ट्रेनिंग जो थी स्किल बिल्डिंग के हवाले से थी कि हमें ज़्यादा से ज़्यादा ट्रेन किया जा सके, जिसमें हमें रूटीन के हवाले से बहुत ज़बरदस्त ट्रेनिंग दी गई। इंशाल्लाह इससे हमारे कारकर्दगी में तकरीबन कम अज़ कम हमारे स्किल बहुत ज़्यादा बूस्ट होंगे।
The National Federation of Red Cross, IFRC, and Pakistan Red Crescent Societies, PRCS, have been tracking field visits by health workers to ensure that all children are vaccinated against polio. Coordination meetings were held to discuss ways to mobilize parents to get their children vaccinated against this disease. These meetings were very productive and resulted in a plan of action that will hopefully lead to more parents get their children vaccinated. Through this mobilization drive, the project has been successful in convincing more parents to vaccinate their children against polio and help protect them from this devastating disease.
With the help of these programs, we have raised the coverage from 2019 at 17% until now, which is 70%. So this is a success story of Pakistan's CDC-funded project.
But the struggle does not end here, as this disease has not yet completely eradicated from the area, and more efforts are needed to save our children from this menace.